so could everyone try to speak up a little bit?
Okay, hi. I'm Caty Fischer. I'm going to read my down and listen to like 3. So my case is the case of the repeatedly barking baby, or everyone's favorite, that pediatric bounce back that just keeps bouncing back. So this is a 3-month-old female brought in by her parents for a, quote, 1-day history of noisy breathing. She was a healthy 3-month-old female born at 36 weeks gestation, delivered via uncomplicated C-section, regular prenatal care, and her mom is actually one of our NICU nurses, which made that a little bit more interesting. So basically, during her first visit, she was known to have acute onset of stridor, rest, nasal congestion, and wheezing. She had an intact appetite, was feeding without difficulty, remaining interactive, and was fantastic. She had no fevers, vital signs were within normal limits, and she had an O2 sat of 100% Romer. A chest x-ray was ordered that showed a, quote, possible focal narrowing of the thoracic trachea, but as always, to clinically correlate, and a perihilar streaky density consistent with a viral infection. The patient was treated with 4 milligrams of oral dexamethasone, racemic epinephrine, had complete resolution of her symptoms, and was sent home. 2 days later, the patient returns to her ED with, again, abrupt onset of stridor. This time she had wheezing and also had a barky cough that you could hear coming down the hall. The patient continued to remain active, playful. She had no feeding difficulty, having regular bowel movements, no fevers. Vitals, again, within normal limits. Except, buried in the triage note, they found that they had read an O2 sat of 89% on Romer on her left great toe and a 97% on her right thumb. That was never readdressed. A repeat chest x-ray was done, which was read as normal, and they sort of upped the workup and did a soft tissue neck that was read out by the radiologist as mild subglottic narrowing, raising the suspicion of croup. The patient again was treated with racemic epinephrine, also this time an albuterol nebulizer treatment. She was already on steroids, so that wasn't changed, and she had complete resolution of her symptoms, and this time was discharged with a pediatric follow-up the next day. The patient returns the next day, sent in by her pediatrician after symptoms have returned, and this time she was admitted to pediatrics for further testing. While on the pediatrics floor, the patient continued to require frequent racemic epi as well as albuterol. She progressed to having constant stridor and was refractory to all those treatments, steroids, and humidified oxygen. She also came to require O2 via nasal cannula to maintain her stats greater than 92%. Multiple tests were ordered. A barium swallow was performed that showed mild compression of the esophagus. However, this patient never had any feeding difficulties whatsoever. OAP discussion was had with the patient's parents, and a CT of the chest was decided to be performed, which revealed our diagnosis, which unfortunately you cannot see. But basically the patient had a double aortic arch with an aortic diverticula that was encircling and compressing both her trachea and esophagus. She also had an anomalous left subclavian artery arising from the aorta itself. We also got that phone call from radiology, and the patient was immediately transferred to a separate institution for emergency vascular surgery performed the next morning. The patient has made a complete recovery since and is developing normally. We've also since seen her in our emergency department, and she looks fantastic. So just some little bit of discussion. Vascular rings, they are rare congenital abnormalities of the aortic arch. They can completely encircle and compress the trachea, esophagus, or even both. These lesions typically present in infancy. However, the variety of presenting symptoms makes timely diagnosis very difficult. In several studies, stridor, wheezing, recurrent respiratory infections, and feeding difficulties were among the most common presenting symptoms. So, in closing, for us in the ER, a diagnosis of vascular ring must be entertained when patients appear with recurrent respiratory or GI symptoms, especially in some situations with a viral illness is unlikely. As you can see, our patient also did not fit into the standard age range for croup, which she was diagnosed with twice prior to being admitted to the pediatric service. These lesions must be corrected with surgery. It's the only thing you can do for them. But however, once these kids are fixed, they do fantastic. These symptoms do not recur. So when these kids come in again with stridor, which this child did come back with stridor, we can reassure the parents that the ring has not come back. It's simply she may not have croup. Thank you. And the